Founded in 1988, World AIDS Day was the first ever international day for global health. Every year, United Nations agencies, governments, and civil societies join hands to campaign around specific themes relating to HIV, including awareness-raising activities around the globe. Many people wear a red ribbon, the universal symbol of awareness of, support for, and solidarity with people living with the virus. These international events highlight the current state of HIV as it continues to be a major global public health problem, having claimed almost 33 million lives to date. However, with increasing access to effective HIV prevention, diagnosis, treatment, and care, HIV infection has become a manageable chronic health condition, enabling people living with it to live longer and healthier lives. COVID-19 pandemic has caused a lot of uncertainty across the globe, including for people living with HIV and AIDS and other viruses. And managing more than a single virus has become a great challenge for many, especially those living in informal settlements like this one. Though there is no direct connection with the two viruses, people living with HIV and AIDS have been categorized as those with underlying conditions when it comes to COVID-19 pandemic. Hence, they must be on a good diet.
Good nutrition is very important because, one, it improves the quality of life by also slowing down the progression of the HIV virus itself. So good nutrition, it increases the chances of person living, and also it reduces the death rate. So good nutrition plays the major key role in fighting the HIV virus and also in fighting the COVID-19.
COVID-19 pandemic has, however, brought about uncountable tribulations, including the country's dwindling economy. Beth Akenye has been living with HIV for the last 5 years.
Hiyo maisha ni ngumu, saa zingine unapata tu kidogo ya kukula. Kiko vitu kutoka yangu. Niseme pesa hakuna, unapata kidogo, una manage, unagawa kidogo ya kulipa nyumba, kidogo unagawa ya kukula.
There were an estimated 38 million people living with HIV at the end of 2019. Of this population, not everybody is able to access HIV testing, treatment, and care. Notably, the 2018 Super Fast Track targets for reducing new pediatric HIV infections to 40,000 was not achieved. Global targets for 2020 are at risk of being missed unless rapid action is taken. This is according to the World Health Organization, WHO.
The under 5s, the pregnant, also the HIV, you talk to a client, they come. The reason why they've got rapid weight loss, they tell you, due to work, I was stopped at work. And this is the person who is the breadwinner of the family. We should also focus on food security, which plays a major role. But in our setup of the community, there are some families, it's hard for them to survive.
Due to gaps in HIV services, 690,000 people died from HIV-related causes in 2019, and 1.7 million people were newly infected. Key population groups and their sexual partners accounted for over 60% of all new HIV infections globally. Among the age group of 15 to 49 years, an estimated 62% in 2019. Over 2/3 of all people living with HIV live in the WHO Africa region, estimated to be 25.7 million people. While HIV is prevalent among the general population in this region, an increasing number of new infections occur among key population groups. WHO defines key populations as those who are at increased HIV risk, like men who have sex with men, people who inject drugs, prisoners, sex workers and their clients, and transgender people. In Eastern Europe and Central Asia, Asia and the Pacific, Western and Central Europe, North America, Middle East and North Africa, these groups accounted for over 95% of new HIV infections in each of the regions. 30-year-old Maureen Ochieng, a peer educator in Kibra, has been living with the virus for a decade now.
Kwa na mimba nikaenda kliniki kama kawaida. Ukienda kliniki mama mjamzito lazima upimwe, na sio optional, la kwanga lazima. So nilipimwa nikapatikana ni HIV positive. Though haikuwa rahisi, haikuwa safari rahisi. Ilikuwa ngumu, ilikuwa on denial for long, but ilifika mahali nikasema hapana, naweza kufa na sitaki kukufa. Ilibidi nijikubali, nianze kutumia madawa.
Dental tu, yani hivi juu hata mimi nilinia kwanza nilijua niko na TB. Sasa hapo ndio nikajua sasa kumbe niko nini na
COVID-19 pandemic has not only affected HIV patients financially but also socially and psychologically.
Sisi ndo tuna sensitize kuhusu hiyo COVID, what to do. Inafaa sisi ndo tuambie watu unafaa kufanya nini ili ujiepuke na hii ugonjwa. So haikutu affect vile sababu tuko kazi, ni vile tu mentally imeni affect kiasi cause nikisikia wakitangaza hata kwa TV ati ukiwa na underlying condition ati ikikupata inaweza kupeleka chini haraka. So mentally nimekuwa worried.
Stigma is one of the major challenges those living with the virus still experience in this day and age.
Nilikuwa naishi na watu hapa, nimeishi na madada wangu. Nimekaa nao for long. Na sasa venye walikuwa naanza kunipea madharau nini hivi, ukimwangelesha na kujibu venye anataka, niliamua kubaki peke yangu na mtoto.
Know yourself, who you are, what do you want, who needs you. Huyu mwenye anakustigmatize ana play role gani kwa life yako?
Just like anyone else, they too have the right to love, be loved and respected in all spheres of life.
Sisi wenye tunaishi na virusi tunafaa kujiprotect during sexual intercourse, na hizo vitu tunatumia ile tu mtoto sasa. Hizo vitu tunatumia, wengine wana complain aziko standard vizuri, zingine zina burst on the process. Sasa inawaweka at risk. Maybe your partner is HIV negative, anapata hiyo risk. Sasa inabidi ameze PEP na hakuwa ready for PEP.
Sijui ni kwa nini wametoa. Na hii pia unajua inasaidia kwa mwili sana. Sijui kwa nini sahihi ipatikane.
Septrin is used for immune-depressed patients to prevent opportunistic infections. HIV can be diagnosed through rapid diagnostic tests that have greatly facilitated diagnosis and linkage with treatment and care. HIV self-tests are increasingly available and provide an effective and acceptable alternative way to increase access to people who are not reached for HIV testing through facility-based services. To date, there is no cure for HIV infection. However, effective antiretroviral drugs, ARVs, can control the virus and help prevent onward transmission to other people. And according to WHO, at the end of 2019, 25.4 million people were accessing ARV therapy. Between 2000 and 2019, new HIV infections fell by 39%, and HIV-related deaths fell by 51%, with 15.3 million lives saved due to ARV treatment. Safi Godana Mamo, Switch TV.